Paclitaxel dilution. Paclitaxel is a cytotoxic drug that belongs to a class called toxins. It is an irritant with vesicant properties, and it has a low emetogenic risk when used alone. The cell cycle specific agent and must be diluted before infusion. Indications. Paclitaxel is used in management of the following cancers: breast, lung, esophagus, ovarian, HIV-related, Kaposi sarcoma, and others. Mode of action. It's a microtubulin inhibitor. Paclitaxel targets the microtubules polymers, which it stabilizes them and protects them from disassembly, thus stopping the cancer cell from forming two new cancer cells. Paclitaxel pre-medication when used as a single agent. Pre-medications are used to prevent immediate hypersensitivity from the drug. They include corticosteroid, that is dexamethasone, histamine 1 receptor blockers, that is chlorpheniramine, diphenhydramine, or ranitidine. Common side effects: alopecia, which happens within 3 weeks from treatment, thrombocytopenia, muscle aches and pain, and joint pains, which normally felt within 3 days of treatment, and transient bradycardia. Dose-limiting toxicities. They include neutropenia, which is low number of neutrophils, peripheral neuropathy, characterized by nerve pain, tingling, or numbness in the hands or feet. Hypersensitivity, characterized by dyspnea, hypotension, bronchospasm, urticaria, and erythematous rashes. Drug interactions. Cytochrome 3A inhibitors increase the plasma concentration of paclitaxel, e.g. ketoconazole, clarithromycin, ritonavir, saquinavir, voriconazole, and others. And strong cytochrome 3A inducers decreases the plasma concentration of paclitaxel by increasing its clearance. Examples include phenytoin, carbamazepine, rifampicin, phenobarbital, and others. It's also advised the patient should refrain from taking St. John wort, which is an enzyme inducer. Paclitaxel diluents. They include 0.9 sodium chloride injection, 5% dextrose injection, 5% dextrose and 0.9 sodium chloride injection, and 5% dextrose in lingers injection. Paclitaxel dilution concentration. The final concentration should range between 0.3 and 1.2 milligrams per ml. The infusion rate is as follows. Weekly doses should be run over 1 hour. Doses over 2 hours. 3 weekly doses over 3 hours. Note: cisplatin, carboplatin, cyclophosphamide increases myelosuppression if administered before paclitaxel. Therefore, paclitaxel should always be administered before cisplatin, carboplatin, or cyclophosphamide. Example: a patient XY is receiving paclitaxel 100 milligrams. How much of the diluent do you require? The minimal diluent is 1.2 milligrams per ml. So in 100 milligrams, we should have 83 mLs. The maximum diluent volume required is 0.3 milligrams per ml. Put about in 100 and you'll get 333 mLs. What does it mean? For Paclitaxel 100 milligrams, we require diluent that range between 83 ml to 333 ml. Those are our references. Kindly research more. And thank you. Kindly share this presentation. Hit the like button and also subscribe. By you subscribing, you help us to grow.